Hi, Tom Suspensky here, and I'm going to take my mask off because I'm 6 feet away from everybody else at least. And here we are, September 15th, 2020. And, we're talking about staying healthy during this pandemic. And next week, or actually this week, on the 17th, there's World Health Organization is having Patient Safety Day. And, it's about staying safe, it's about staying healthy. And, the original name for my office here was Mind and Body Fitness. And there's a big connection between the body and not being healthy and how it affects the mind. And, a lot of people get depression because they can't move or they feel like trapped in their own homes. So people are now starting to go out and exercise more, and we're here to try to help you and give you some tips on what you can do to stay healthy. And I've been involved with sports medicine for over 35 years. I've worked with professional athletes, the Philadelphia Eagles to be exact, when they used to have training camps in Westchester, and I learned a lot about preventative medicine. When I was at Brandywine Hospital, I was director of sports medicine, and we actually got involved with telling patients how they could stay healthy through nutritional supplementation, which was approved in 1999 by the American Medical Association and also in 1999 by the American Dietetic Association. So there's a lot of different tools that we can use to keep you healthy. I mean, as an orthopedic physical therapist, I work a lot with people who have back pain, knee pain, shoulder pain, people that come out of different surgeries, and we look at and we try to diagnose what the condition is and how it affects your daily life. Then we try to develop a structured plan. Well, when you look at your health, it's the same thing. You have to come up with some type of structured plan. And after the pandemic, and I want to thank everyone who has supported me over these last 3 months. It's been amazing. And you can get emotional about it. And I'm going to try to stay online because I'm an emotional guy. But, you have to keep moving. You have to keep exercising. I want to thank the people that came in here and supported my practice. And I'm here for you because if you're going to your doctor for prevention, they're overloaded in their offices. There's a big backlog. Some of these hospitals have lost millions of dollars, hundreds of millions of dollars on the fact that they weren't able to do elective surgeries. Now they're back doing elective surgeries. There's a big backup of patients. And who do you come to and who do you trust to give you expert advice on nutrition, losing weight, staying in shape? Well, I want to be that resource for this county. I want myself and my staff to be able to, help the people in the county to stay healthy. And some of the things I've learned over the years when I was at Brandywine Hospital is we were looking at, this was back in the 90s, and we were looking at how do we continue to earn income when insurance groups are only going to pay a certain amount for different diagnostic procedures. And I raised my hand in a group of doctors, and I said, why don't we talk to people about nutritional supplements and staying healthy? And at the time, I was working with the Philadelphia Eagles, and they wanted to know a lot about how they could keep their athletes healthy so they would actually put them on trauma IVs after injuries with vitamins in them, and it was amazing how well they healed. So I started taking that concept and I tried to explain to physicians how they should strive to get people healthier by boosting their immune system, getting rid of toxins in their body, and also how to progress in terms of gaining muscle mass and losing the amount of fat in your body, which causes a lot of harmful effects in different diseases like diabetes, heart disease, cancer. They're all related to, body weight and toxicity in the environment. So some of the things I learned, I have some products here that I've been touting and talking about for the last 18 years. And this company, Isagenix, started in 2002, and I became very familiar with them because they came up with a cleansing and fat burning system. And I said to myself, why would I be involved with something like that? A cleansing and fat burning system. Well, I had allergies at the time, And I realized by cleansing my body, what that means is getting a product into your body that helps get into your liver, your kidneys, and also helps some of your fat in your body release toxins, which you basically urinate out. It helps boost your immune system, and it also helps you get rid of unwanted fat. And then so this was the product I used back in 2002. It's called Cleanse for Life. And I've put hundreds of patients on this product. It has aloe vera from the inner heart fillet of the aloe vera plant, and what it does is it actually helps repair the digestive tract if it's inflamed. It also has burdock root, fennel seed, and these ingredients actually get into the liver and the kidneys and help cleanse the liver and the kidneys and help the body get rid of toxins. Why do you want to get rid of toxins? Well, if you have allergies, if you have toxins aboard, your allergy symptoms are worse. If you have problems with asthma, your asthma is worse because your body's fighting these elements to try to boost the immune system. So very effective product. A lot of people go around during the pandemic and they say, I'm all stressed out. Well, this is a product that helps reduce stress. What's so bad about stress? When you have stress in your body, cortisol is released from your pituitary gland. And what happens is with cortisol, the adrenal gland. With cortisol, what happens is it actually causes you to store fat. So this product helps you cut down on the amount of stress, and some people out there are stress eaters right now. They're walking through the kitchen, they're stressed out, they're not going to work, and this product is excellent for that. And then people say to me, Tom, what about protein? How much protein should I eat? A lot of people have problems losing weight because they don't eat enough protein to sustain their lean body mass. So this protein shake actually has 23 grams of milk whey protein. They also make it in a vegan form. So people can have vegan protein, they can have milk whey protein. But the thing I love about whey is the fact that whey boosts your immune system. One of the most powerful antioxidants in your body, and if we're talking about COVID and we're talking about the flu season coming around, we want to increase the amount of cysteine and glutathione. Glutathione is the most powerful antioxidant in the body, and this has cysteine, which is a precursor to developing glutathione. And by taking this product, it actually helps boost your immune system. It also feeds your lean body mass, and that helps you burn fat. So this is an amazing product in terms of taking care of the body, boosting the immune system, and getting you at the right percentage of lean body mass to body fat. This product I've been taking for about 9 years now. This is a telomere support product. This has a lot of research. And folks, I'm just telling you, I went through a lot here in a very short period of time. If you want information on this, you can email us at healthcheckpt@gmail.com, and I can send you in videos about the medical science with physicians talking about this product, how it was developed, how there are third-party studies on this product. But this telomere supports formula basically supports your cells when they divide. Your cells divide billions of times in a year, and your body makes new cells, and when cells are remade or they divide, there's a genetic structure within the cell called the telomere. If the telomere shortens with each division, what happens is you can end up having premature aging. So this helps the cells divide and reduces and doesn't let the telomere shorten, which is the genetic material of the cell. What's so important? We want to protect cells. An onslaught of not having the right amount of antioxidants in the body creates genetic changes or cell changes, which can lead to precancerous conditions or cancer. I'm not saying that these products, and we can't say that, they don't cure or mitigate any illness or dysfunction. The body's the real healer. All it does is support the normal structure and function of your body. And that's what I promote, and that's what I've been promoting for years. And when I was the director of sports medicine at Brandywine Hospital, when I used to have to talk to the medical staff, I would have PowerPoint presentations for the doctors to explain what the products did, what were the optimal doses according to the FDA of different vitamins that were needed. And I clearly went to the physician's desk reference and showed physicians what was in their PDR, which was a bionutrition section that went through some of these aspects. So this is the preventative side of healthcare. Healthcare is a reactive problem in the United States. We're not the healthiest nation in the world. We could be. We have the technology. If you look at athletes on the sports fields in the United States, in the NFL, in the MLB, and some of the other sports teams, you'll see that they follow very technical guidelines for nutritional supplementation. They try to keep their athletes as healthy as possible because they're on contracts and they want to keep these athletes healthy. So if you want information, I'd be glad to give you some more information on the products, send you some videos, and we can go from there. Again, our email is healthcheckpt@gmail.com. Thanks for listening.